Yep. So good evening, everyone. So happy to bring to you something slightly different today. I'm going to be talking to Dr. Ravi Modali about telemedicine and telehealth. Dr. Modali was the top ranker in the International Board of Certification in the International Board exam, Lifestyle Medicine in 2019. He contributed to the growth of value-based healthcare as a medical director of Vidal Healthcare, which was originally TTK, subject matter expert in adoption of health analytics, telemedicine, and digital health in mainstream medical practices, hospitals, and healthcare systems. Scripted 2 chapters in the medical management for the first academic book in health insurance and for the Insurance Institute of India. So that's kind of a very varied um, portfolio for a physician, Ravi. So tell us, put things in context for us and tell us how this all started and where you are with telemedicine. Sorry.
Thank you, Sheila. Actually, as you were introducing me, you took me back to my history and all the fantastic moments I've had while I was transiting in my career path. Thanks for putting it together. And friends who are joining in, greetings for this festive season, what we are in between Dasara and Diwali. Compliments to all of you. And also Eid festival was yesterday. Compliments of the great season to all of you. And yes, I think in my career path, I was fortunate to actually get to the latest introductions which were happening to field of medicine, be it insurance earlier 2 decades back,
Yes, I think
or technology recently where medical adoption has been happening. And telemedicine has been this year, 2020, in India, telemedicine practice guidelines got introduced through the Medical Council of India. That is a huge step ahead, giving a lot of comfort to doctors on using technology within the medical norms. And let me share a few slides about what brings us to this. It's not just COVID. I mean, otherwise, it would seem like it was because of COVID is what telemedicine became relevant. So, Sheila, if you allow me, I'm going to share a few slides so that it's easy for people to
Sure, you already have,
understand.
Ravi.
Thanks a lot. Yeah. So it's like this. Let's take a reality check. And as I would share the points, it will be easy for us to assimilate the things. So health always was a need every time, everywhere by everyone. It's only the disease condition where we need a medical intervention on a conditional basis or a selectively at time. So with the good health, the progress of health, we have realized rise in the life expectancy. 1950s in India, the average life expectancy was 46 years, and we have increased it to 68 years with all the good developments in the medical field. And at the bottom, at the foundation, it was improving health. Now, what we have seen with the onset of chronic disease conditions, the boundaries between life, health, and disease is blurring. So, I mean, people keep talking about, am I living a good life, or do I have a disease without symptom, or do I really have good health? All these questions are on. It's sort of blurring the boundaries. And what we have realized very closely is the variety and intensity of symptoms has increased over time as we got more and more intelligent about our lives and our health and more words to our human lives, to the symptoms. We got more sensitive towards them. And we are living the pandemic where we are seeing low intensity of symptoms and threatening, life consequences, type of crippling life type of a thing. Entire global economy has come to a halt, for the sensitivities what we are facing. Diagnosable conditions are rising, but without symptoms, causing burden, and treatment cycles have become long, almost lifetime, and we need to do something around that. And medicines and surgeries, we have realized the limitation of these. Of course, whenever they are needed at the right time. But all said and done, they are not sufficient to actually realize the better side of health for a long, long time in life. And at the end, it's about, we are all looking at longer years of life, but we are spending these long years of life with poor health. And all of us want to do, I think the entire medical fraternity is together to try to do something around these. I mean, if you're seeing the image, this is the type of world that we are living in when we want to define health or understand life. And a lot much to do around the lifestyle medicine is what brief context I'm going to set across. Very briefly, the type of risks what we are facing as declared in the year 2016, if you would see the list risk factors in the year 2016 here as I'm pointing it, I'm just reading them, we'll realize it's nothing to do with diseases. It's all about to do how we are living our lives. Malnutrition, air pollution, dietary risks, high blood pressure with or without hypertension, high fasting plasma glucose with or without diabetes, tobacco, water, sanitation and hygiene, total cholesterol with or without dyslipidemia, high body mass index, alcohol, occupational risks. We work to earn, but we are taking risks, impaired kidney function, unsafe sex, other environmental conditions, physical activity being low, low bone mineral density, sexual abuse and violence. The top 17 risks what we face is entirely to do with how we are living our lives. And that's enough to talk about why daily dependence on health, good health, and in a structured way, in a way how we can do. Last slide to put the context in place, well-being, which is the other perspective of health rather than absence of disease, you see the elements which are being measured to actually assess whether well-being is proper or no. Life expectancy, feeling safe, homicides, air quality, working hours, water quality. I mean, look at these: household income, job strain, labor market insecurity, everything what is concerned about the way we work, the way we live. I think that is the context in which we are talking about. Health needs to be addressed more wider than just disease. And that's where the value and worth of telemedicine comes in, where the doctor services can be accessible anywhere, anytime. Thanks, Sheila, for asking that questions.
Do you want to stop share, Ravi, or you have some more slides?
Then you go ahead, we'll keep conversing. I think I'll keep
Okay,
sharing the
you
slides
have
at the end of it.
continuation. Okay,
Yes,
okay,
Sheila, thank you.
okay. So my next question to you, Ravi, is tell us exactly what is telemedicine and how is telehealth different from telemedicine?
Sure, Sheila. I think that's a very appropriate question now, since we have realized, health is different than a disease and the perspective of medicine. Let me share the definitions of telemedicine as the National Medical Council has put in the telemedicine practice guidelines. So, telemedicine is the delivery of healthcare services where distance is a critical factor. We are making a distinction between an in-person consultation is of the utmost value when it comes to telemedicine and when it comes to medicine in terms of prescribing. And after that comes telemedicine. So when distance is a critical factor, the role of telemedicine comes in. And this is relevant by all healthcare professionals. The key element is use of information and communication technology here, for the exchange of valid information for diagnosis, treatment, and prevention of diseases and injuries. Also, the scope of research and evaluation is included, but with a lot of governance and regulations. There's also continuing education of healthcare workers with the aim, now this is important, advancing the health of individuals and communities. That's how telemedicine is defined under the telemedicine practice guidelines. Now, if we see the definition of telehealth, which also has been defined in the telemedicine practice guidelines, Telehealth is delivery and facilitation of health. So that's quite distinctive and clear. Delivery and facilitation of health as the first thing. And then health related services, including medical care, what we have mentioned under telemedicine. Also, provider and patient education, also health information services, what we are seeing in for COVID times. Every morning we wake up looking at the numbers. What are the number of cases? What are prevalent new cases detected? Am I in the containment zone? So we are living the example of how health information services are important on a daily basis. And another highlight, self-care. Okay, these are the two distinction features, delivery and facilitation of health, provider and patient education, self-care. These are the three distinct elements what makes telehealth a more important element in the entire gamut of affairs using telecommunications, digital communication technologies. I would also like to bring in a mental health act which got released in the year 2017. What it says is a good mind is able to make life meaningful, purposive, and play an active role among people. Now, this is relevant to all of us. It's not talking about disease-based, mental health. It's talking about well-being-based mental health. And the key element is a good mind should be able to live without the need to tolerate toxic lifestyles, symptoms, sufferings in health, and struggles in life. So we are seeing stress prevalent. I think Mental Health Act talks about how we need to find our ways to keep away from these. And hence, anytime, anywhere access to mental health is the need for everybody at all ages. So certain elements what can be adopted are tele-screening, digital e-screening through survey tools, telehealth, teletriage, telemedicine, tele-coordination of medical travel, tele-rehabilitation, all play key roles in this spectrum. This aligns very well with the telemedicine-based medical insurance, a structured way of financing healthcare, across various systems and insurance schemes. The Mental Health Act of 2017 in India also privileges advanced directives. People can make choices how they want to experience healthcare, how they want to recover from diseases or protect themselves. They have a right what they can use, and feel strong about that. Thank you, Sheila.
So, why did you focus just on mental health, Ravi? Is there a specific reason? Aren't there other specialties that also practice telemedicine?
Well, you're absolutely right, Sheila. What I tried to do in the previous three slides, what has been taken a regulatory form.
Hmm.
These are something which are built as acts, which means it is mandatory for all licensed medical practitioners to actually adhere to them or use them wherever they are relevant. Of course, we are on track. In fact, between us as leaders in lifestyle medicine, we have shared our side to the National Medical Council, and we are looking at how we can adopt it. I think this session also what we are holding is to propagate the good values of lifestyle medicine across all medical specialties, and we are on track.
So, how does a doctor get to start practicing telemedicine? How does he register? Is there a platform?
Absolutely. I think what the guideline says is it has given a doctor a scope of opportunity within the norms. I think that's what the guidelines does, and it is a medical governance aspect what has come in. So from that point of view, what a doctor can expand his scope of practice is what I'm showing in the slides. Otherwise, we were used to diagnosing, giving a prescription, and then preparing for a procedure. Either it is a surgery or a diagnostic procedure, and then things like that. Those were the areas where we were limited. And we also saw the lack of the other two aspects. Patients complain, I don't think I'm taken care of completely, or just the surgery is done, but it's paining here and all the stuff. So the other two layers which are mentioned in the slide, where as a patient is suffering around health. So how to give appropriate care, how to give the positive health experience, even if the procedure is painful, how to respect the needs, the daily needs of the person, things like that, varieties of things, what can be done. As also, as a person, financially, it is always a challenge, for hospital-based care. In the struggles in the life, at the time of, undergoing treatment for the symptomatic or whatever, how the entire system is supportive, with the corporates who are paying for the services, or banks which might be, honoring the checks and all, how the admin burden can be eased out, and reduce the level of struggles. So putting all these three things together is what essentially the spectrum of practice opens up. And ultimately, we are seeing a goal of a happy, healthy human, which I mentioned there. Having said that, what looks like, I mean, it's ultimately a whole person approach, what needs to be coming in with the practice of telemedicine. I try to build a logical operational tool where I think first and foremost, what the guidelines talk about is freedom of choice is there always. A doctor can choose anytime, whether it is telemedicine or it's in person. A patient can choose anytime, whether it's a telemedicine or in person. And here's the beginning. Suppose a patient triggers a call, either with a video, audio, or through text, through smartphones, text messages. First and foremost, what needs to happen is identify each other. Physically, we are able to see each other. Over a phone, it's very important to identify each other by name, by some ID, or maybe the mobile number confirming of, the address, varieties of these things, and a consent. Typically, when a patient calls a doctor, the consent is implied. If a doctor is calling a patient, which should be in very few occasions, a formal consent needs to be taken. And then we need to rule out any emergency situation. Now, this is very important. What guidelines talks about, it makes it very clear. First, rule out any risks. If going ahead through a telephone, related call to continue the medical care, first rule out emergencies, or if the person needs to travel to a hospital, be very clear around that. All this comes under the triaging function. Having ruled out emergencies, and when we know the person is safe and we can continue ahead with the telemedicine call, that is the time when we open up the conversation, understanding the patient, the way they see health happening, the way they see the suffering happening towards them. Ideally, it should be allow patient to talk, and that's more important. So there is a standard of 20 minutes minimum consultation time, where patient speaks 80% of the time, is what is key to make it a successful call. In those elements, you're taking history, you're going through the reports, investigation reports, past records, asking for more details, and always the choice of shifting the mode of conversation always lies ahead to both of them. And then as the details would come in, then the questions, is the case appropriate for management via telehealth, or it's a medical condition and the patient needs to come in person? So those distinctions. If the patient needs to come in person, before closing the call, share some amount of health literacy, counsel them of why we need to discontinue this telephone and you need to come in person. So people are very clear. Otherwise, it's a chaotic movement. That patient has come to hospital. After patient has come to hospital, doctor says, you know what, you needn't have come. Things would have been done. So all these chaotic things suddenly goes away, and there is a clarity, and hence the visit to a hospital, which will be only for the required condition, and wherever it's not needed, telephonic mode of conversation can continue. And in the management through the telephonic mode, health evaluation becomes key. Counseling is an element, and specific treatments. Now here, mainly lifestyle medicine, which targets at reducing the risks people are taking in their lives. That is the objective. And hence, my belief is lifestyle medicine is a fantastic clinical discipline, which aligns very well with the telemedicine practice guidelines. And hence and it's also the first level of assessment and treatment. That's where the value comes in. And after that, it could be, if at all any medicines are needed, then under the audio video consultations, a doctor can prescribe list A medicines as prescribed under the telemedicine practice guidelines. So these are the operational stuff about how a doctor can understand telemedicine practice guidelines and move ahead So key aspects are slow clinic mode, allow patients to talk. Health literacy is a very important component through while practicing telemedicine. Evaluating health needs to be very thorough. Counseling is an important element, and the first line always lifestyle medicine. By this, doctor is adhering to the telemedicine practice guidelines and giving best value to all their patient populations. I just wanted to share this bit where longevity medicine, which comes through a huge element in lifestyle medicine, where we all are seeing chronic conditions for people suffer for a long time. So as I populated here, the x-axis here, 0 to 120 is the calendar age which people live, and functional ability, the maximum ability what I can reach and sustain throughout life. Typically, we know, at the age of 20, we are ready to earn. We have earned the best learning, understanding of life, earning age. And then this is something which happens. There's the aging seems to be happening very early before our expectations. It brings down our vitality, our quality of life. It reduces us through diagnosis, which otherwise we name them preventable. And this is the suffering what we undergo. And to shift this suffering, to actually sustain functional ability over a long period of time is something very important. Every medical specialty needs to practice, and lifestyle medicine has a way which every clinical discipline can use. That's the intention. And not going through the details, but I'm just summarizing as there is an intake assessment where between the choice of six, a doctor can choose whether to address all as intake assessment or choose only to go by symptom and move ahead with diagnostics, which happens in many disciplines. Otherwise, in lifestyle, we check well-being state, we check the mode of life, whether it's illness mode or wellness mode. We do a lifestyle assessment, we look for risks analysis and evaluation, and periodic health checks becomes important. So those are the choices available, which telemedicine opens up these choices to any doctor. Non-medical advice in the form of protective practices as what got popular in through COVID experience. It's relevant for many other clinical conditions, including diabetes, hypertensions of the types. Adopting wellness lifestyle is all entirely non-medicinal approach. Preventive care programs at a program level, what can be practiced, and more specific things around lifestyle medicine, around intensive lifestyle treatments, continuous health improvement programs that are global best practices which can be adopted again to any clinical discipline, be it cardiology, be it neurology, endocrinology, to any discipline, it aligns very well along with lifestyle medicine, disease reversal programs, and then comes the relevance of prescriptions, either medicines, procedures, or surgeries. Typically, all prescription-related ones medicines, there the risk of treatment also needs to be assessed along with the risk of disease. Whereas if you see all the previous A, B, C, it's about the risks what people are already taking. The idea is to minimize them. So that's the spectrum in which a doctor, in the last 10 minutes, whatever they have heard, if they're able to absorb, yes, I think I have an opportunity by using telemedicine, for my clinical discipline, I think we made good of that last 10 minutes, what we have spent in the slides.
So, what should a doctor do to provide the telemedicine service to his patients?
So as I said, I think the flowchart, this flowchart which I shared is the operational element where the
Okay.
doctor can during consultation he can use these,
No, what I
this
mean is,
flowchart which
no,
yes,
what I
please.
mean is, does she get on a platform, or is this about direct phone calls, WhatsApp calls? How does it work?
Okay, Acha, from that point of view,
Yeah.
though the telemedicine practice guidelines doesn't define anything specific around that, but practically speaking, it's just with the routine telephone line what we have. You pick up the phone, get in touch with the patient, and you're using your own medical notes, as you are doing regularly. You're filling up your notes. Only thing you're mentioning, this mode of consultation was under telemedicine. That's good enough.
Right.
But when you want to adopt telemedicine using Restall digital health and the machine learning tools, artificial intelligence tools, there are varieties of providers who are working, and they are as creative as each doctor is creative in using the protocols in their personal ways. So it's an entire varieties of options are open up. So I'm aware of some platforms which allows electronic medical records,
Mm.
where it gives you a checklist, and and that checklist can be specific to what you are using, or it could be specific to your clinical discipline, and the symptoms what you're having in the mind is the order comes in the same way, so that the digital flow is actually in the flow of the way it's happening in your mind. So these are all the ways how things can be configured, and that they are, I mean, not many doctors might be comfortable, but the early adopters doctors have actually gone ahead. So the clinical protocols, what we know, they have worked with technologies to build clinical protocols in digital health systems. So then there is a mirror type of effect. What I'm thinking, the system tends to be following that same logic, and hence there is a value proposition between the digital health platform and the doctor, and hence natural telemedicine. What happens that you are aligned, more of information coming in the digital system, your mind working, and then you're enabling a patient. But I would say this is advanced technology. It's not yet there in prevalence, but for a doctor who wants to know it, enough options are available. I hope I answered the question, Sri.
Yeah, yeah, you did. And regarding the prescription, so how in telemedicine, when you're consulting over the phone, how does the doctor give a prescription? Is it a written prescription that's photographed, or is it just verbal?
Absolutely. I think the first thought which came to your mind is practical and it can work. So you are writing a prescription on a routine paper. You take a photograph of that prescription. And if many people are using smartphones and also a WhatsApp message, you have given to their personal mobile number. So this is what is easiest, what can be done.
Right.
Now, if at all there are rare occasions, maybe in the rural areas where I'm taking a very rare scenario where it's a patient who's working on a landline, and a doctor is working from an urban area. If that is the situation, then a doctor typically either sends the medicines along with the prescription, so the person gets the medicines and the prescription together.
Mm-hmm.
And I'll tell you what actually solution is working. I'm just trying to say what guidelines permit. And suppose there is SMS is allowed. Smartphone is not there. The old type of mobile phone. Through SMS, the medicines can be given with a disclaimer that the actual prescription is coming over by post or whatever. It's reaching the local coordinator, and for you to know what medicines have been prescribed, just mention the medicines with the dose and all. SMS. But what has happened, even in the rural India today, the structure of a care coordinator has come. So there is a person who's trained in using telemedicine who sits in a kiosk type of a thing or a makeshift health clinic. It could be a nurse who's trained to manage telemedicine, or it could be a paramedical who's oriented, who does this logical work. So they can actually note it down, or they can have a smartphone. So one smartphone can be used for all the people who are visiting the clinic, and hence technology becomes very easy to adopt. So these are the ones which is being practiced in the national program, be it Ayushman Bharat, where the wellness clinics are being tested, or it could be the primary health center or a sub center where an ASHA worker is able to do on the same lines.
Okay. And what about COVID? During COVID, Ravi, how does this relationship, how does this telemedicine function, and how does it benefit people?
Absolutely. So important. I think COVID has opened up so much, for consciousness. So let me get there. Let me open the slide of that. Okay, so here it is. So what we have realized in COVID is the social well-being in lifestyle medicine. What we talk about, the social resonance, the social connectedness. The social well-being essentially has been the key to for people to protect themselves. And I think what I'm sharing here is people need to feel a strength within themselves, which can be enabled by practitioners like us. And lifestyle medicine has specific modules around that, protecting themselves, you know, and form new values, the new normal, what we are talking about. How do we find new ways, by protecting ourselves, yet getting into economy and, following all the norms and, behavioral related practices and all, and then emerge as a new society. And we continue the protection and still adopt. So I'm talking about 8 basic questions where we need to find answers, where it aligns, how the herd mindset and how the herd behavior from a personal to a social and then economic productivity, how it connects. So here is the thing. Question people need to ask themselves: are people around me keeping physical distance and following personal protective practices? What usually happens is when no one is seeing, no, I try to open up and try to feel normal. Only when someone sees, I'm actually trying to show that I'm practicing. We need to grow beyond that. It has to become a habit. So that's the perspective in this first question. Second question: can I talk about my symptoms without fear? The positive mindset, what is nurtured in lifestyle medicine, positive psychology, how I can talk about cough and openly and say, fine, okay, fine, I'm feeling a little cough and all, so I'll follow the protocol. And I just wanted all of us to know without feeling a fear that, somebody might feel wrong about it or you start hating me or something like that. What people will think if they see me with this in the new avatar, with a mask, the helmet, with having wearing coat, disinfectant coat, varieties of them. Such feelings should not be there, and people need to work to grow over that. Can I be productive while working from home? Very important for our economy to run. Otherwise it's a change. Unless until I see 4 of my peers, unless until I feel the pressure, that kick to work doesn't come in. Things need to change. At home, when I'm with my family, I need to be focusing on my work. That's a paradigm change. Am I protecting myself when I'm moving out of home and protecting myself in all the places what I visit? What is my health and wellness identity? Today is a time people need to know whether their immune system is working good, if they're diabetic, if they're hypertensive on some medicines, if they're ailing from a heart or some immunocompromised situation, are their lifestyles reduced of the risks and increases the prospects of reaching optimal immunity. That's an important health and wellness identity each one of us need to have and share to each others, among our peers, so that we feel the comfort of that herd mindset of positive health, herd behavior of a positive change. Can I maintain all my relationship by optimizing my online activity as well as my physical travel? What new opportunities open up with the new normal? A healthy lifestyle clearly opens up a lot of prospects of how to come out of fears and concerns and move into more of opportunities and prospects. And hence, we'll get our automatic response. What is the core destiny and what co-creations we can do? As a population, we move ahead, and COVID otherwise is a very weak virus, but still it has stretched all of us. How we move ahead safely, securely, and to a better world. I think those are the few questions. If we are able to answer ourselves, we are in the new normal, and it's much relevant from the COVID point of view. Thanks, Sheila.
And how are patients taking to telemedicine, Ravi? Is there an acceptance amongst patients? Are they happy?
Okay, so as you talked about whether patients are, patients know, they listen to doctors. And doctors, if they are comfortable with all the latest things which have come, then patients want to listen and want to feel, get the better side of it. Now, let me share a few perspectives. What is happening in the corporate world? Corporates run health and wellness programs for their people. And what people are coming with? They're coming with their aspirations, with their human resourcefulness. They're putting in effort to learn, grow, work, perform, and produce results. This is what typically work happens in a workplace. But what hampers them? Varieties of limitations do come in, right? And let's look at, a direct relationship. This effort, where does a corporate want people to work? The functional ability what people bring in, corporates want them to show in community and social level, the way we network with people. Economic and finance, for the salary what we are earning, how much returns we bring back to the company. Workplace and business, doing the business activities very well. less of presenteeism, less of confusion, less of complexity. Directly do the most important work, what you're supposed to do consistently. And also, as we travel and all, take care of the environment. These are the things what any corporate would need. But now look at this, what is actually happening. On the left side, what we are seeing is, from the psycho-socio-economic state point of view, we are seeing aging coming in very fast, conflicts among different people, among social circles. That's the reality what we are seeing, and we have to do away from that. From biopsychosocial state, we are seeing stress, anxiety, depression, and happiness seems to be the missing piece. Stress, anxiety, and depression seems to be going up. A lot of value what we can bring in as doctors with the speciality of lifestyle when we adopt the lifestyle approach to care. And then the biophysiochemical state, where we are talking of functional diagnostics like diabetes, hypertension, atherosclerosis, hormonal disorders, sleep disorders, allergies, varieties, cancers, all these are coming. All these are, by the way, preventable, is what we say, but still it is happening in high prevalence. And it's happening in the spectrum of the corporate world. So corporates as a huge buyer of care for their own people is where the demand goes up. And whatever corporate offers, people are willing to try and take it. I have two other versions. Insurance as a structured approach to invest in the personal health and get the best out of it. You see the spectrum of telehealth, telemental health, teleauthorization, which is insurance specific, telemedicine under insurance, and teleclaims. That's the spectrum of medical practice what we are seeing in health insurance. Now, as an insurance, it's enabling use of healthcare services to all the policy holders. So once an insurance company declares, and Insurance Regulatory Development Authority has already released the permission of telemedicine to be used where it is relevant. And here we see the premiums, you know, the liability of poor health comes with age and adverse lifestyles like smoking, alcoholism, salt, excess sugars. All these are preventable. And there are incentives which insurance companies are willing to pay if people reverse these conditions and manage their own health care. Healthy lifespan increases productive life years. That's where people earn money, insurance are profitable, and then a healthy society to live in. And benefits what comes for people are as simple as just do regular preventive health checks. Just continue your insurance coverage over a long time. Insurance companies are happy to give incentives. Follow healthy lifestyles. Insurance companies going to give a lot of reward points, loyalty programs, and waive off a lot many restrictions which were there. This is the type of, the demand side of activity which are happening. Yeah, not getting into too much of details, I also want to talk about the government initiative, which is aggregating all the poor population in India, accelerating towards health for all in the name of Ayushman Bharat, a set of wellness centers. Concrete plans have been set up right from February 2018, right from setting up budget to setting up clinics. There is a plan to operationalize 1.5 lakh health and wellness centers. So medical care, health coming very close to people, only for them to reach out and access, close to their homes. It talks about continuum of care, telehealth. It talks about expedited service delivery. Government is talking about multi-skilling, especially in the coordinated care, what all we talked about. Partnerships, multidisciplinary approach of how health can be enabled within clinical teams, paraclinical, technology, and clinical varieties of prospects. Community mobilization and health promotion. That's where lifestyle medicine plays a huge role. IT systems, financing, new ways of financing so that people actually will enjoy better health over a long time, and everybody has that benefit. So this is the type of demand side changes which have happened. So people just need to reach out and just enjoy the benefits of better health. System is already set for people to use.
Right. So do you want to have you? Yeah. So if there are any questions from the Facebook viewers, we can take a question if anybody is I just need to log in. I think I've logged out of Facebook. Let me just check and see if there are any people. So
Okay.
how does typically how do people pay in during these teleconsults, Ravi?
So there are a lot of online payment tools which are already on. I think people are comfortable in other industries, say buying
Mm-hmm.
groceries online or
Mm-hmm.
buying services online or subscriptions. You subscribe and many services automatically will keep coming to you. You know, you
Yeah.
need not think at every episode of purchase. So
Yes.
variety of, I think for healthcare, we have the benefit of experience already happening in rest all industries. And it's just a matter of adopting and declaring that you can transact with medical care systems online. We have adopted the regulations and you are in safe hands, even if you call by telephone.
Okay. So I'm very I mean, this was a really, really extensive and I think quite an elaborate discussion talk. And self your slides were self-explanatory. Obviously, I'm really hoping that this takes off in a big way because, like you said, lifestyle medicine has a huge role to play in telemedicine. It is definitely an aspect of medicine that can be conducted over a phone, over video, because a lot of it has to do with communication, talking, and motivation, coaching, etc., etc. So, do you see
Yes.
lifestyle medicine taking, or rather, telemedicine playing a very important role for lifestyle medicine?
Absolutely, you said it right, Sheila. For me, the three of the latest developments, which is, of course, lifestyle medicine globally has been evolved formally just 4 to 5 years back. And
Hmm.
happy to be with you and few of us lifestyle medicine practitioners in India, where we brought in. Otherwise, we know the time lag, what it takes to build in, then bring new technology to India.
Yeah,
Along with that, telemedicine as also digital health. So lifestyle medicine along with telemedicine and digital health, three of them put together, it's a huge enabler for any medical practice, for any healthcare provider across India and also globally. And
yeah,
we want to play that important role, you know.
right.
The acute care becomes more safer. Acute care comes at the right time, information gap comes down. And I think what I've been hearing about the fear of, you know, too much of prevention will actually put a lot of specialities, you know, will make them redundant.
Not at
In my experience, I haven't seen that. Yeah,
all.
what I'm seeing is, if you
Yeah,
see in that longevity graph which I have shared, it's diseases are going to come at a later age rather than diseases coming early and a doctor feeling that, you know, okay, fine, if you're preventing diseases between 30 and 70 years of age, then, you know, I'll not have work. Diseases are going to come between 50 and 80 years of age.
right.
People are happy living longer. They will have made their money and they are happy to pay for the new technologies which are coming up in the acute care. But if we don't contribute to the economy, the financial economy, and then we say that, you know, diseases, early onset of disease also okay, I'm ready with reactive care, surgeries and all. People are struggling with, you know, the financial economy. And
Right,
that's
right.
where the health economy, if it has to improve the financial economy, lifestyle medicine, telemedicine, and digital health is the way for any medical practitioner, for any corporate, for any government.
Yeah, absolutely, absolutely. I think you made some very, very valid points there, Ravi. If there are no other questions, Sunil Kumar joined and said it's a brilliant presentation, Ravi. Lots of info I could gather. Thank you, Sheila, for the invite. So that's very nice. There are 7 comments which
Thank
I'm
you,
going
Dr.
to.
Sunil, and
Yeah.
welcome to ISLM formally.
Yes. Yes. So I'm not quite not able to see the others. Okay. So yeah, I think that's just thanks for this. Are there any lifestyle medicine telehealth platforms to date? Nikki Gomez asks. Are there any
I should
lifestyle
thank
medicine tele?
Nikki. Yeah, thanks, Nikki, for
Yeah,
asking that question. In fact, as you ask that question, I see an entrepreneur in you, a doctorpreneur in you, if you're a doctor. That is the intention. I think today, I think Telemedicine practice guidelines are not even an year old. It's March 2020 when it got started. And it's a right time for us medical practitioners to think what could be the way, our way of using telemedicine and digital health. We create the clinical protocols and then use in partnership with digital health companies. Maybe at a national level, also there are initiatives at an individual level. These initiatives are needed. So if you are able to think on those lines by asking a question, please think in lines of making it for yourself and bringing out the good practices, which all of us would like to hear. And same to all other doctors and all other thinkers who are attending this session.
Yeah, yeah, absolutely. So yeah, like you said, I think we'll have to create the protocols for, for a consolidated kind of practice. At the moment, I think individual lifestyle medicine physicians are practicing, are using telemedicine, doing long distance counseling. I myself do that. So there, we do need to have a more systematic protocol that other people can follow, that all lifestyle medicine physicians can follow, like the psychiatrists,
Absolutely.
like the psychiatrists have come out with their own agenda.
Absolutely.
Yeah.
Yeah.
So I think that's important, and that's something that we should put down on our on our to-do list, Ravi. So just as an
Yes.
add-on, Dr. Ravi Modali is also the treasurer. I think I forgot to say that he's also the treasurer of the Indian Society of Lifestyle Medicine. So as you can see, a very sharp mind that really keeps us on our toes, and I am happy to have him as a treasurer. Keeps me on my toes. So, if there are no other questions, we're almost at, almost at an hour, Ravi. So, thank you very much. I think this was very, very educative for everybody watching, and it will be on Facebook as a recorded video, and you can always, we'll share the link with you and with anybody else who's interested. They can come back and watch it, and I think we could share it on the ISLM Facebook page as well. We'll do that.
Perfect, Sheila. Thank you as president of ISLM for modestly conducting this session of being the host.
My
Honored to be
pleasure.
with you and responding to your question.
My pleasure. Thank you so much, Ravi. Thanks everyone for joining, and we'll
Have a great day. Thank you all.
have a great weekend. Bye bye. Bye. Bye, Ravi. See you.
Enjoy festive season. Bye.
Bye.